Day and good morning still. Welcome to the Office of the Governor of Guam. My name is Crystal Pacos and Augustine, Director of Communications here at the Office of the Governor of Guam, and we are delighted to host you this morning to proclaim March 24, 2025 in recognition of World TB Day. But before we begin our program, of course, I want to acknowledge the presence of our Honorable Governor Lilian Guerrero in the front right here. From the 38th Guam Legislature, Senator Will Parkinson. Repping the Department of Public Health and Social Services, your Director, Teresa Ariola. As well as her Deputy Director, former Senator Amanda Shelton. Also want to recognize Chief Public Health Officer, Catherine Ancala, DPHSS. And let's give a big round of applause for the Public Health TB team. We have some partners with us this morning as well. Marco Pasco, Lieutenant Environmental Health Officer for Naval Hospital Guam. Dr. Paul R. Mayo, the Second Commander and Director for Public Health at Naval Hospital Guam. You're welcome. Chelsea Lewis, Captain U.S. Air Force Biomedical Scientist Corps, Public Health Flight Commander, 36 Operational Medical Readiness Squadron, Anderson Air Force Base, Guam. Yes. As well as Darren Hall, Commander, Occupational Health Department Head for U.S. Navy. Susan Smasi for coming. And to tell us why we're all here today and clapping for one another, I want to give the floor now to Teresa Ariola, Director for the Department of Public Health and Social Services, for her opening remarks.
Thank you, Crystal. Thank you, Crystal. Thank you, Governor, for your time. Thank you, partners, Senator, my Deputy Chief Public Health Officer, but most especially, I have to acknowledge my TB program staff. So if you could please stand to be recognized. Our military partners, please. Who are my, come on, stand up. Ladies and gentlemen, these are the men and women of the TB, Public Health TB program who work tirelessly every day. Our military partners, thank you for joining us this morning. Good morning, and thank you for joining us today as we recognize World Tuberculosis TB Day. This is not just a ceremony, it is a call to action. TB remains one of the world's oldest infectious diseases, yet it is both preventable and curable today. We reaffirm our commitment to eliminating TB and ensuring that no one in our community suffers needlessly. The theme of this year's World TB Day, Yes, We Can End TB, reflects our collective responsibility to commit, invest, and deliver on this goal. Here on Guam, our TB program has made incredible strides in prevention and treatment. The dedication of our staff and partners has not only saved lives, but has positioned Guam as a leader in national TB policy. This year marks a significant milestone as we celebrate Chima Bakwem's election as president of the National TB Coalition of America and his distinguished recognition as a 2025 CDC U.S. TB Elimination Champion. Please, let's give Chima a round of applause. He's currently not here today with us in South Island, but I'm sure he'll feel your love. Thank you very much. His leadership not only underscores Guam's rising prominence in public health, but also serves as an inspiration for others in the field. We also want to honor Teresa Manalo with us today, whose unwavering dedication and exemplary leadership in patient care earned her the prestigious NTCA Carol Bosick TB Nursing Award. Additionally, we want to commend Ms. Alice Cuenca for joining the ranks of 2025 CDC U.S. TB Elimination Champions, recognizing her contribution in the fight against TB. The Guam TB Control Program and the Bureau of Family Health and Nursing Services has also been recognized as 2025 CDC U.S. TB Elimination Champions for their role in tackling the multi-drug resistant TB outbreak in Guam. The CDC U.S. TB Elimination Champion Project provides a valuable platform to celebrate these remarkable achievements and to share best practices with those who are committed to eradicating TB in the United States. Together, we are making strides towards a healthier future. Our partnership with CDC, CNTC, and CITC, the vocabulary of alphabet soup, have allowed us to introduce innovative treatments, including the compassionate use administration of they spelled it for me phonetically, Delamidid, sorry. It's a drug for pediatric TB cases. The first on Guam. In response to a multi-drug resistant TB outbreak, our rapid coordination ensured timely evaluation and treatment of affected individuals, including Guam's first pediatric MDR TB case. Additionally, we have successfully completed retreatment for relapsed MDR TB patients, the fifth person in the U.S. to relapse to the new treatment regime for TB called BPAL or Bedhaquelmin. Close. Belaquamin. Why do drugs have such difficult names? As well as Protaminin and linozolid. This successful retreatment is a clear demonstration of the resilience of the TB program in fighting drug-resistant TB. Prevention and early detection are indeed critical, and our team has taken a significant step in this direction. We have adapted the California Department of Public Health's Prevent TB in 4 Steps, a guide to support medical providers in treating latent TB infection in Guam. This adaptation is a reassuring measure that will undoubtedly help in reducing the incidence of TB on our island. We also have implemented new technology, such as cardamodil, 6L for real-time EKG monitoring in the field, enhancing patient safety and treatment adherence. I should have the nurse read this. Our success would not be possible without strong partnership through collaboration with GMH and the Block Grant Office. We continue to provide radiology services to uninsured patients exposed to infectious TB. Additionally, we have strengthened our workforce by welcoming new TB program staff who will support our growing efforts. While we celebrate these achievements, challenges remain. We must continue addressing barriers to treatment, expanding physician support, and eliminating the stigma that discourages individuals from seeking care. Ending TB requires all of us, government leaders, health care providers, our community members, our military partners, to work together. On behalf of the Department of Public Health and Social Service, I thank our TB program team, staff, healthcare partners, and community advocates for their dedication. And I also want to recognize Governor Lou Leon Guerrero, most especially. When the United States pulled out of WHO, the governor leaned over to me and said, whatever it takes, we're going to still do whatever we need to do to eliminate TB and help our region. So thank you, Governor. Let's stand together and commit to a future free from TB. Thank you, and Situus Maasim.
Thank you so much, Director. We're going to do a spelling bee of all those drug names later on. I now want to give the floor to the Honorable Lourdes A. Leon Guerrero, of course, registered nurse, our Governor Lou Leon Guerrero.
Thank you, Crystal. Welcome, Senator. Thank you for your presence here. Therese and Amanda, thank you. And of course, our military partners. And of course, public health and the hospital for the work that they do to really eradicate tuberculosis. March 13th is the 5-year anniversary of when the first COVID positive case was in Guam. And that was the most scariest day of my life, because as a nurse I knew that at least what we knew is that this virus was being spread by respiratory air droplets, and we all know how fast those viruses can spread in their mode of transmission. And we in Guam really did not have a playbook for the pandemic. And the saving grace was public health, because public health was really experience in contact tracing, experience in monitoring, experience in going out there into the community. So CHIMA basically used the same process that we used for tuberculosis tracing and tracking and identification, and actually laid that process over to the virus. And that was the beginning, I think, at the foundation of how we were able to continue with monitoring. You know how you find one positive, then you got to find out who are these people connected, where did they go? Oh my gosh, I remember when one of the military people was positive, and we had to trace where all the restaurants that person went to. And it was just really a time of tumultuous and just uncertainties. But with public health's TB program, program and their way of tracing tuberculosis or communicable diseases, especially respiratory, that was the basis. And so I just want to say thank you for that, because as a result of that, we were able to save more lives. And we were able to make the mandates that we needed to do to save more lives. The same way, we need to be just as diligent and committed and persistent in eradicating tuberculosis, because as we all know, it's a preventable, curable disease, but we need to catch it early. And Therese was actually correct about the World Health Organization. I am also very concerned about US aid being eliminated, because now we're reading we're in these places where US aid was helping with tuberculosis treatment and tracing and so forth. We're seeing now an increase in tuberculosis there. And why is that important for us? Because it travels. And, we're right here in the Asia Pacific region. We're very close to countries that have increased tuberculosis cases. And I think most of our cases are imported. I think our pediatric case was an imported case. And so that is why we need to look at it from a global perspective and from an international, worldwide perspective, right? So as a result of that, we need to be much more cautious, and we need to be much more diligent in tuberculosis. And with the advances, with the technology and our ability to go out there into the community who have no access to health care, I think we need to use all of our resources to do that. And so I just want to say to everyone that we do have great experts. I mean, CHIMA, nationally recognized. And, you guys recognized for the work that you do just speaks to the kind of talent and experts that we have on island. I think we're very innovative because we feel like we're so far away that we don't have the resource immediately in our hands. So we read and we train ourselves, we educate ourselves, and we use models and frameworks that would help us expand and update and improve the way that we do our work. So just having recognition of today as the World Tuberculosis Day, it's a proclamation, but one of the reasons we do proclamation, it's a way to wake up the community. It's a way to again, reinforce community awareness. And I know that you guys don't think it's just today. I know you guys think it's, every day of the year for the rest of our lives. And so that's I think, admirable. And I just want to thank Therese and Kat for your leadership. And of course, now Amanda, I know she's excited working with you guys because she told me the other day when I asked her how's public health, I'm really excited, Governor. I love working there. And it was only like 4 days into March, but that's a good sign. But we need good people, to be our advocates in public service and to be the ones to be implementing public service for the good of our people and our island and our community, and not just here, but regionally also, right? I know you guys communicate regionally also. And so just the amount of resources and energy and work that we have is to me a great acknowledgement, and thank you for all your achievements and accomplishments and your very innovative ideas. And I know we work very closely with the military. I just wanted to let you know that during the pandemic, it was Admiral Manoni during that time, and he literally lived here in Adelaide. No, serious. He was here every Monday to do press conferences. We spoke every day. Because we were sharing protocols and information that was available for us to move forward. And then, of course, the USS Theodore Roosevelt, when they came and we housed them in the hotels. And it's just a great feeling of really partnership, cooperation, working relation, because we have to. We are here and we have to be able to work very closely together. And so we're very thankful for your partnership in also this program to eradicate tuberculosis. Because, TB doesn't say, oh, I'm not going to infect this sailor because he has to go out and save the country, right? It doesn't have any borders. So anyway, I just want to say it's an honor to proclaim today as the World Tuberculosis Day. And again, I cannot overemphasize our appreciation on behalf of the people of Guam for all the work that you do. And please continue. And Teresa's right. Whatever she needs, we will get what you guys need to make sure that you do your job. So, si Diyos Masi and Viva!
Viva! Si Diyos Masi, Governor. Now she was reminiscing about our response to COVID-19. She's right, former Admiral Manoni. We used to call it Manoni Monday. Press conferences in this very room would take about 2 hours, 2+ hours, and reporters weren't even in the room with us. We were learning how to adopt with Zoom. So we've come a long way. And of course, we used what we knew in the technology we had with TB and contact tracing. And my first memory of Chima is him teaching me how you guys use your app to FaceTime people so that you can see if they're taking their medicines. So you don't have to physically go to their homes. And so the way we've adopted technology and we're using it today, thank you so much for all your work in keeping people of Guam safe. With that, though, now I want to call to the podium. Yes, Manoni Mondays. We all fondly remember Manoni Mondays. Ms. Relaida Samailo, Supervisor 1 for the Department of Public Health and Social Services. I want to call her to the podium to read our proclamation.
A proclamation number 2025-26, a proclamation of the Governor proclaiming March 24, 2025 in recognition of the World Tuberculosis Day. Whereas, according to the World Health Organization in 2023, approximately 8.2 million people were newly diagnosed with tuberculosis, the highest number recorded since WHO began global TB monitoring in 1995. TB again has returned to being the world's leading cause of death from single infectious agents, surpassing COVID-19. Whereas, according to the Center of Disease Control and Prevention, in 2023, tuberculosis case counts increases among all age group, among U.S.-born and non-U.S.-born persons in most reporting jurisdiction. Overall, cases increased from 8,320 in 2022 to 9,615 in 2023, an increase of 1,295 cases. The rate has also increased from 2.5 per 100,000 person in 2022 to 2.9 in 2023. Whereas the number of TB cases in Guam, which had previously decreased to 45 cases in 2023, is now rising. In 2024, Guam reported 60 new cases with an increased rate of 35.5 per 100 residents, surpassing most states in the United States. This resurgence of TB in Guam is the cause of immediate concerns and action. Whereas, according to WHO, multi-drug resistance TB remains a public health crisis and health security threat. It is important to remember that TB is preventable, treatable, and curable disease. This fact should inspire us to redouble our efforts in combating TB on Guam. Whereas the successful elimination of TB on Guam is contingent upon strong political leadership that unequivocally supports every detection, accurate diagnosis, prevent treatment, and high-quality care, particularly for drug-resistant TB. Whereas urgent needs to combat TB demands immediate and robust financing to eliminate the gaps in access to TB prevention, treatment, and care. The economic burden of TB is sufficient, with the cost of treatment and loss of productivity. We must allocate necessary resources, particularly funding, to enhance the quality, sustainability of TB diagnosis, prevent, treatment, and care services. Whereas to alleviate community awareness regarding TB, educating the public with the modes of transmission, the associated symptoms, the effective prevention strategies is essential. It is crucial to dispel myths and misfortune and to actively combat stigma and discrimination among individuals affected by TB and their families. Whereas healthcare providers play a crucial role in the fight against TB, they must incorporate TB services routine health intervention and be adequately supported and empowered to deliver essential TB preventive services. This includes comprehensive training, promoting up-to-date TB information among healthcare professionals. Healthcare providers must be equipped with the necessary resources and knowledge to provide health quality care to TB patients. Whereas we are firmly committed to increasing stakeholder involvement in TB activities within our communities. We recognize the vital importance of community engagement in our fight against TB. It is essential to mobilize young individuals to become advocates to TB awareness and to ensure that TB patients receive the necessary support, resources, and compassion for the community. Everyone has a role in the fight. Whereas World TB is a day to educate the public about the impact of TB worldwide, the Guam TB program, along with our partners and colleagues, acknowledge our successes in TB prevention and control and raise awareness of the challenges that hinder our progress towards eliminating the devastating disease on Guam. And whereas the theme of the World Day 2025 is Yes, we can end TB, commit, invest, and deliver. A bold call for hope, urgency, and accountability. Political commitment and investment will help deliver TB dividends to the communities most affected by TB, improve our health system capabilities to address TB epidemic, and use a diversified approach to bring political, community, and civil society leadership together to achieve the cross-sector collaboration to eliminate TB on Guam.
Now therefore I, Lourdes de Leon Guerrero, Magahagangwahan, Governor of Guam, by virtue of the authority vested in me by the Organic Act of Guam as amended, do hereby proclaim March 24, 2025 in recognition of World Tuberculosis Day. Together with the Acting Lieutenant Governor Frank Ross Jr., we have affixed in the capital village of Guam, the Great Seal on this 21st day of March in the year of our Lord, Anno Domini, 2025. Viva!
Thank you so much for the signing of the proclamation. Of course, the reading of the proclamation by Ms. Relita Samailo. I'm probably giving you a new name. Can you pronounce it?
Yes, you pronounce it correctly.
Yes, thank you so much, Jay. Thank you so much for joining us here. I want to invite everyone to the front for a group photo. Let's celebrate our work together towards TB awareness and all our efforts to keep the people of Guam safe. Thank you so much for joining us here at the Office of the Governor of Guam. Hope you have a great weekend ahead.